Good morning, everybody. It's so nice to see old and new friends and colleagues here this morning. Happy to have this opportunity to share most recent work and to have this discussion today with our esteemed colleagues on the panel. As the sluggish recovery of the U.S. economy continues, many cities and regions are looking for strategies to grow jobs and improve overall standards of living over the long term. Increasing the human capital of workers through education and skills training is one critical pathway. In order to maintain globally competitive, the U.S. workforce will need to make continued gains in education and skills. Forecasts show shrinking opportunities for lower-skilled workers over the next several years. Georgetown's Center on Education and the Workforce projects that by 2018, which is not that far away, nearly two-thirds of all job openings will require a post-secondary education. What's more, much of this increase in the demand for high-skilled workers comes from upskilling in jobs that previously did not require these credentials. So the demand for more educated workers seems to be rising fairly quickly. And as the baby boomers begin to retire over the next 2 decades, these shortages will persist. The graying of the U.S. population combined with low birth rates means that immigrants and their children will become the primary source of labor over the next several decades. Now, I have to have a little bit of demography in every talk that I do. So here I'm going to show you the age structure of both the native and the foreign-born population, what it looks like today. The immigrant population is heavily concentrated in prime working ages. And you can see while slightly more than half of the U.S. population are 20 to 64 years of age, 79% of the immigrants are in that age group. The real difference between the two is in the child population, 30% of the native-born population versus only 9% of the foreign-born population are 19 and under. This is primarily due to the fact that most children of immigrants are born in the United States. Thus, immigrants and their children will constitute the majority of the supply of workers going forward. Already, we've seen the immigrant share of the labor force rise from about 5% in 1970 to more than 16% in 2010. And if we add the children of immigrants, those born in the United States, to foreign-born parents, 1 in 4 workers is currently first or second generation American. The Pew Hispanic Center estimates that virtually all of the growth in the labor force over the next 40 years will come from immigrants and their children. If this is the case, ensuring that this population is prepared for a competitive U.S. market is essential for the strength, growth, and health of the U.S. economy. Getting ahead of myself here with the slides. So I'm going to go back. Forgive me. The paper I wrote today in today's discussion focuses on immigrants who are already living in the United States and who, with some additional training and guidance, could move into jobs in high-demand sectors to the benefit of local economies. And as Amy pointed out, metropolitan areas, cities, and regions are the context where immigrants integrate into labor markets, and we're focused on regional initiatives that unlock the skills of professional immigrants with foreign credentials or build the skills of immigrants who are primed to advance in jobs through targeted training programs. I focus on 2 groups of workers in the paper. The first are foreign-trained professionals who face a number of obstacles to working in the United States in the occupations for which they were trained. It's not uncommon, especially in some metropolitan areas, to hear about the nurse who works as a nanny or the engineer who's driving a cab. Many immigrants are in a similar situation across the country of unemployment: doctors, scientists, information technology specialists, and others in highly specialized professional fields who've already invested in their training elsewhere. The other group of workers are immigrants who, with some training and improvement of basic skills, including English language preparation, could be ready to move up the career ladder, but they're in need of support to get there. These are workers who are in low-wage jobs that could become healthcare administrators or auto service technicians if they had training and support and a clear career pathway. Both groups encounter barriers common to newcomers to this country, such as not knowing how to navigate the U.S. job market, an absence of networks that could help locate suitable jobs, and sometimes low English proficiency. But often the barriers, especially for those trained in professions outside of the United States, are more formal. Their credentials are not recognized by U.S. employers, or they haven't figured out the complex licensing and certification requirements that come with certain regulated jobs, say in healthcare or engineering. These immigrants essentially have skills, usually in industries in high demand, but they're barred in the ways that I've just mentioned. Okay, now we're ready for this graph. Before I go any further, I want to talk about a few issues related to the profiles of these immigrant workers, specifically their educational attainment. About a year ago, I put out a paper with my colleague Matt Hall from Cornell University on the geography of immigrant skills, and in that study we found that immigrants were much less likely to have a high school diploma than natives, but they are on par with the native-born when it came to having a bachelor's degree or more. So here I'm showing data that come from the Census Bureau's 2010 American Community Survey on the educational attainment of the native-born population, the immigrant population, and in the last column, immigrants who arrived within the last 10 years. And here you can see that, yes, immigrants hold bachelor's degrees at more or less a rate similar to natives, but they're much more likely to lack a high school diploma. You can see only 9% of the native-born population does not have a high school diploma, compared with 30% of the foreign-born overall, and the same 30% for those who recently arrived. So it's interesting to note that among the cohort of more recent immigrants, they're slightly more likely to be high-skilled than the total. So we're bringing in people now that are tilting more towards high-skilled or those with a college education or more. But the middle-skilled are still the largest group for both the native-born and for the foreign-born. The ability to communicate proficiently in the English language is a fundamental skill for the U.S. labor market. So let's look at immigrants and their labor and their English language ability. This is measured by respondents who report that they speak English either very well or less than very well. So everybody who very well is the top category. So in the red, you've got very well, and in the yellow, less than very well. Of note here are the differences by skill level. The majority of low-skilled immigrants lack proficiency, 84%, while still half of the middle-skilled are not proficient. Even among the high-skilled, 1/4 or 26% do not consider themselves to have an excellent command of the English language. And these rates are even higher when we look at the newcomers, the newest immigrants that have just arrived in the last 10 years. 1/3 for high-skilled, 2/3 for the middle-skilled, and 90% among the low-skilled. Given this single indicator, it's not surprising that high-skilled immigrant workers are more likely to be underemployed than their native-born counterparts. And here I've estimated that nearly half of all immigrants with at least a bachelor's degree were overqualified for the jobs they held, as compared to 1/3 of native workers. And among new arrivals, the rate is higher, 53%. And this is actually about 1/2. This means that new arrivals are about 1/2 more likely to be working in jobs that they're overqualified for than their native-born counterparts in similar jobs. This is a measure that compares each worker's level of education to a national occupation-specific average, again using American Community Survey data. And if their educational attainment is one or more standard deviations from the mean education in that occupation, they're considered overqualified for their job. So the question that this paper asks in our discussion today is, how do forward-looking regions make the most of immigrants living in their areas? Foremost, they view these immigrants as assets, and assets to their labor markets and their communities. They help move these immigrants into jobs they were trained for or put them on career tracks to accelerate job mobility, to increase earnings, and to augment local revenue. They assist in getting immigrant workers through obstacles that prevent them from working in fields that they're trained in. The approaches that are discussed in the paper and that our panel will be discussing share the characteristic that they are intentionally aimed at the resident immigrant population. workforce specifically. So let me make it clear that these are programs designed to work with people already living in U.S. communities. It's not a suggestion to bring in additional immigrants to the United States, change the status of those living here, say from temporary to permanent, or for one region to poach from another region. Our panel of practitioners and leaders in the field have a lot of firsthand knowledge about these kinds of programs, so I'm not going to spend much time discussing them in detail. However, some of the best programs and best initiatives include partnerships between nonprofit organizations, educational institutions, and employers to build skills of immigrants for jobs that have been identified as having a short supply of workers. And this usually happens through a regional assessment of employer needs and a lot of discussions that happen and projections that are made in industry-specific ways. I highlight programs from Washington State, Miami, Portland, San Antonio, and suburban Washington, D.C. in the paper. These include programs that largely integrate skills in English language training or adult basic education to train workers for jobs such as certified nursing assistants, healthcare administrators, pharmacy technicians, die setters, assembly workers, and automobile service technicians. The best ones, such as the Training Futures program, which is located, it's a partnership here in suburban Washington, D.C., offer clear career pathways and sufficient support to ensure workers finish their degrees or certificates and make connections to employers. Other programs aimed at immigrant professionals trained abroad help unlock their skills to move these workers into jobs commensurate with their skills and experiences. Initiatives in Chicago, San Francisco, New York, Boston, Denver help immigrants understand and clear licensing requirements, navigate the U.S. job search process at the level that they want to re-enter, acquire U.S.-specific professional language in their field, and work directly with employers to market this cohort of immigrants. The Welcome Back initiative, for example, is operating in 10 locations across the country, and it works exclusively with healthcare professionals to retrain and get credentials needed to practice in the United States. So in summary, metropolitan areas have a tremendous opportunity to build the capacity of their workforce from within by investing in immigrant residents, especially by targeting sectors with shortages of trained workers, and also by unlocking the potential of highly skilled immigrant professionals. Many of the programs highlighted in this paper are run by nonprofits or partnerships between nonprofits and educational institutions. Community colleges play a very prominent role, and they should. They are affordable access points for training, and many have proactive agendas to provide education for immigrants and their children. But many of the programs that help workers build skills and that create career pathways are reaching both native and immigrant workers, expanding the supply of regional skilled labor. Regional economies matter, but state and local governments, educational institutions, nonprofits, and civic and community leaders all play a very important role in how immigrants integrate into regional labor markets. Investing in human capital through education, skills training, language training will drive economic prosperity over the long run. Making sure immigrants are part of this process, even those that need extra help, has to be part of regional growth strategies. Before we have the panel come up, I want to introduce Suzette Brooks-Masters. She directs the migration portfolio at the J.M. Kaplan Fund. It's a family foundation in New York City. She's a leader among her peers and has been at the forefront of thinking about immigrant integration issues and in shaping our knowledge on a number of subjects, including immigrant educational access, high-skilled professional workforce integration, and receiving community engagement. Prior to joining the fund, she consulted with nonprofit organizations working on behalf of immigrants and refugees, including the Catholic Legal Immigration Network, the Migration Policy Institute, the American Immigration Law Foundation, and the National Immigration Forum. She's also published extensively on immigration policy subjects. And she's served on a number of nonprofit boards, including the Lower East Side Tenement Museum, when we all want to do that, the Hebrew Immigrant Aid Society, the National Immigration Forum, Lawyers Alliance for New York, and New York Cares, an organization that she helped found. I've known Suzette and admired her work for almost 10 years, and I'm absolutely delighted that she's here to join us and to moderate the panel that we are about to have. So welcome to Suzette, and welcome panelists.